Brandon Idlett with a work week weather that's brought to you by Docomo Pacific. Let's go ahead and head over to the NMI now, where our CNMI correspondent Tomas Manglona is standing by in the KUAM News Link Zoom room. Tomas, good morning.
Good morning, Chris. Jason Joester. Just wanted to give the latest COVID update over the weekend. Lots of new data coming out. Of course, the tragic news of the CNMI 6 COVID-19 related death. The Commonwealth Healthcare Corporation telling us that the patient was unvaccinated, passed away this month, and the patient tested positive for COVID-19 in November, and the patient was admitted to the alternate care site at the Kanoa Resort facility. And with regards to the latest COVID-19 case counts in the CNMI, from December 8 to December 9, the CNMI reported 260 new cases. 174 of those cases were identified on December 8, which is the largest single day count. 86 of those cases were identified on December 9. And also catching up with data that was just released over the weekend, the CNMI reported 134 new COVID-19 cases confirmed from December 10 to 11. 86 of those were identified on December 10, and 48 of those were identified on December 11. And so this brings the total case count to about 1,908 cases, Chris. And also just wanted to remind everyone, if you're listening in the CNMI today is the first day for the antigen testing, free drive-through antigen testing. No registration is needed. Those who want to get tested must bring an ID. This is, of course, being held in partnership with DFEMS. This starting today will run on Mondays, Wednesdays, and Saturdays from 8 a.m. to 4 p.m. at the Cagman Fire Station, Garapan Fire Station, and Sasupi Fire Station. Again, if you're listening in the CNMI, these are free antigen tests available now today from in the following weeks, Mondays, Wednesdays, and Saturdays from 8 a.m. to 4 p.m. at the Cagman, Garapan, and Sasupi Fire Stations. Of course, this being big news, as antigen test results will be available within 15 to 30 minutes of that test, and results from DFEMS, they note, will not be counted as an official result documentation. However, this is for surveillance purposes. And Chris and Jason, I asked the hospital how many antigen tests they have, and they said they have about 25,000 last we checked, just before we headed to the weekend. I wanted to shift gears a little bit and talk about some developments with regard to the CNMI governor's investigation. And so after the NMI Governor's Legal Counsel met with the Legislative Committee investigating Governor Torres, the committee chair, Selena Babata, told KUAM that they're rejecting the proposal that they put forth. The governor's lawyers met with the committee in a closed-door meeting on Friday morning, and after they objected to the House subpoena, saying that Governor Torres has executive privilege and that the investigation is not legitimate. And so the governor ultimately not appearing before the committee on Friday. The governor, Selena Babata, tells us may already be held in contempt for failing to appear, though he has yet to. They asked that Governor Torres testify under oath on Tuesday, December 14 at 10:30 a.m. That's tomorrow. And the committee tells us that if he shows up, they agree to not pursue a contempt charge for his no-show last week. So Chris, that's some of the latest information so far with regards to COVID-19 and the investigation. Do want to emphasize again, can't emphasize enough that the free antigen testing starts today, 8 a.m. to 4 p.m. at the Cagman, Garapan, and Sasupi Fire Station. And yeah, that's the latest. And we'll actually be interviewing the CEO on primetime tonight live on Saipan because this antigen testing huge program rolling out is meant for surveillance purposes. We are still in a surge here in the CNMI.
Yeah. Okay, Tomas. How are you doing, though?
Doing well as can be. Today I'll be going out to the different fire stations to take a look at the crowd there and hopefully safely speak to some people. Before you'd have, this expanded testing is one of their huge efforts right now amid this surge, and they have 25,000 antigen tests available.
Wow.
And that's a lot. It's so you know, to have this access to the testing is great. And so, again, Mondays, Wednesdays, and Saturdays at the Cagman, Garapan, and Susupi fire stations.
Yeah, Tomas, I had a question because a couple of weekends ago, you reported that there was that one pharmacy that is like one of the few places like outside of a government venue where people could get tested or something like that. And that was more or less like pre-surge for the CNMI, right? Like, have you heard about like how the traffic has been to there, or like what the demand has been?
Yeah, I mean, they continue to be fully booked, you know, for days on end. And things have changed now, of course, with home quarantine and isolation being an option. So now if you test positive, you're asymptomatic, and you live in a house that allows you to isolate, you can stay at home. And just on Facebook, you can see a lot of CNMI residents now sharing that they're positive and that they're staying at home. I think it's interesting because I know in talking with public health throughout this pandemic, one of the things they tried to tell people is that getting COVID is not a jail sentence. But for many people, it almost felt like that, because if you got COVID, you were brought to a facility and told not to leave for 10 to 14 days. And so hopefully this home quarantine and isolation, you know, encourages people to get tested if they feel that they're exposed, and maybe not feel as though they have to keep it a secret, right? And so as Jason was pointing out with Dr. Lombard's comment the other day, the CNMI is now at about 91% vaccination rate. And as we test more, the test positives will increase. And we are also starting to report on the latest data they provided with regards to recoveries as well. And so just wanted to share that. Yeah. As of yesterday, Tomas, the CNMI Healthcare Center saying that 669 people have recovered so far as well.
Yeah, we talked about this last night, right? So with this surge, what are the numbers of people who have received the monoclonal antibody treatments versus the number of positives? Because I'm just trying to figure out, with this surge, are people mostly asymptomatic? Are you seeing more mild cases? Because with our Delta surge here, that's what they said they were seeing for the most part. But we did see those very troubling deaths, especially with the elderly and those with pre-existing medical conditions.
Yes, and so last we checked, this data is a week old, but thank you, Chris, for reminding me. I'll follow up on that today with the MAB treatment, because there are federal teams here from the National Disaster Assistance Team who are here specifically to administer the MAB treatment. Last we checked, it was about over 100 who received it, and they also encourage folks that if you have symptoms and you test positive, of course you can receive this treatment at the alternate care site, or you can also walk into the hospital ER and receive that treatment. And so we'll follow up today. In fact, the federal team is supposed to leave today or tomorrow, last we checked. And so it'll be interesting to find out if they are going to be staying a lot longer. Again, we'll have an interview with the CEO live on Primetime tonight regarding all of this, because this really is just the beginning of the ramping up of the response to this surge. And we'll continue to bring you the latest on that. I'm not sure how long the lines will be at each of those fire stations, but I do know a lot of people want to get tested.
I was thinking of something over the weekend, Chris. Like, you've got so many friends like throughout the Marianas, right? Have you reached out to anybody that you know over there? I mean, because with the number of surges and lockdowns and and restrictions that we've had to go through, comparatively, the CNMI has. I mean, this is their biggest one to date and everything like that. Have you had conversations with your friends up there and said, this is what you can expect to happen as far as, timelines and everything like that. And this is, you're going to be, okay as long as you keep doing what you have to do.
Yeah, I just told that to Tomas last night. Right.
Yeah. And,
that counts.
A week from now.
I was like, hang in there. That's why I asked him, hey, are you okay?
About a week from now, the restrictions that the governor put in place will expire. It's unclear if they will change or extend. Of course, we'll keep a close eye on that.
What are they now, Tomas? Because I'm just trying to, in my mind, imagine, is it totally dead up there in Saipan where you're at, for example? Are people allowed to go around, or is it like you can't go to the beach, you can't exercise?
I think it's fair to say, actually, someone commented on our Instagram post saying that they drove around and it felt like a regular day. Of course, given that the holidays are coming up, those gatherings are especially of concern. We do know that public health did say that most of the spread is happening within the households and not necessarily the businesses or the offices. So that's why it'll be interesting to see, given the numbers that we've been reporting, triple digits on December 8th, the largest single day report. What will happen with the restrictions, whether or not they'll stay in place or if they'll adapt to address what is actually happening. And so, yeah, we'll wait and see. Unfortunately, we'll have to wait and see.
Exactly. Tommaso, I know that you're working on a new episode of Pacific Matters, right? And I just dropped the debut episode of my new podcast series, The Chronicles.
Yes, and to everyone listening, that this is a total coincidence. I was telling Chris, I was like, "Wow, that was pretty cool that the Chronicles podcast was released at the same time."
Actually, when he told me that, he was like, "Dude, that's like pretty cool that you came out with your Chronicles podcast and then came out with my Pacific Matters on cannabis, bro."
Well, because
do you guys remember having this conversation or what?
we do, Jason. I don't know what you're implying.
We talk, Jay. We talk.
But,
I got a friend.
No, it's interesting, right? Because one of the Chris, less than 10 minutes in, Saipan was brought up in that conversation.
Yeah, and it was brought up
at
Tommaso. It was brought up. Of course, everybody knows there's so much competition and everything between Guatemala and NMI. But I just want you to know, Tommaso, it was brought up in the context of what the hell does Saipan do that we're not doing right? Like, they already got it over there in Saipan. We don't. So it wasn't like a negative connotation. It was more like, hey, let's go check out Saipan. How are they able to stand up
not
everything
in particular
quickly?
the people I interviewed, but in talking and doing my research for the story, those in the NMI say, just go ahead and take your time. We'll take care of the industry. Right now. And so I'm not sure we have that clip, but did want to share. We did get to interview two amazing people who are making their mark in the industry, and this is Victor Cabrera, who received one of the first licenses. So take a listen to that.
If you grow from seed, you're looking at about anywhere between 4 to 5 months from seed to harvest. That's because the plant needs to go through its vegetative state, and then from there it goes into its flowering state, and then the harvest itself. Now, that's just from seed to harvest. However, you add on another anywhere between 2 weeks to 4 weeks for curing, which is you take the product after it's dried and trimmed, and you let it sit and set for a couple weeks and kind of marinate, because you don't want to just take it from trimming and sell it out, because there's still a lot of chemicals in the plant itself that you want to kind of slowly go away, and you want to enhance the flavors, the scents, the smells. So it takes a pretty good amount of time. You're looking at about 6 months from seed to sell. Now, if you were doing cloning, which is what I've switched over to, you're looking at eliminating about 4 weeks, 5 weeks from that whole process. So it's still anywhere between 3 to 5 months. Yeah, so it's a pretty long process, and the trick would be to try and get a cycle where you'll be able to move certain amount of plants every month. So in creating that cycle, you ensure that your product is consistent, and you're able to provide to the retailers who are expecting supply to be coming in. So it's a process that's a little bit tricky for me. I'm still learning it, and it's not there's no document out there, book that's made for this, so I'm kind of figuring it out as I go. I look towards the states that have legalized cannabis and are in the industry already. I look towards their policies more so versus their techniques and their growing methods. I think the growing part of it I can figure out on my own, but ensuring that I stay aligned with what's required by law, and how guys in the States are doing it, how these companies are doing it, what software they're using, what applications, So those are the things that I keep up to date with. I don't really, I kind of try to rely on my knowledge of plants. So I don't know, it's kind of hard because I always see it this way. I'm also a beekeeper. So the one thing I've learned was, as a beekeeper here in the Pacific, it's completely different from beekeeping in states, right? Stateside. You have to deal with winter. Here we've got summer all year round. Our bees are productive all year round. They don't need a time to go to sleep, you know what I mean? Like winter, they don't hibernate, they don't, so it's different. And For the most part, I do, follow up and I read on information from the states like Colorado and Washington. Arizona is the latest one that's pushing out all kinds of producers. So yeah, I try to keep up with the news in regards to that. The commission always throws out this word every time we meet. As a pioneer, I'm like, man, that word's a very scary word for me because that's a double-edged sword. I mean, you look at all the pioneers who went to California way back, and a lot of them didn't make it. You know what I mean? So it's a learning experience that I've had with the commission where we work together. I share information with them. I ask questions constantly, and we want to try and see how we can help each other because they are the leading authority in the industry, and I like to see how we can work together to ensure that we keep the industry secured here in the CNMI. And I say this in the sense where I've watched where companies in Colorado and California have come in and taken over and basically closed out all of the local growers, the local retailers, and they've gone big, they commercialized it. And that's fine for the industry. Yes, our government will benefit from it, but on the same note, will our people benefit from it? And I think by working closely with the commission and sharing those thoughts, we can always make sure that we get back to that. And we always make sure that, we protect our industry here for our people first. And then, we expand from there on. And as a part of my livelihood, I want to ensure that this business survives, I was telling my wife that one day I'd like to pass this business on to my son, who's still a minor now. He's 17, but by the time he's 21, hey, who knows? Maybe I might retire early, and he'll be paying for my trips to off island and Japan, because I like sushi. So I've come across people who still the stigma is still there. I'm not gonna say that it's not. The stigma is still there. Understanding cannabis and its purpose is something that's going to take a while. I believe it might take a while. I am fully in it for the medicinal values that I've seen it do for all kinds of people around the world. That there's so many documented cases. I'm in it for the local perspective, where it's been around for so long, and all these reasons. However, I do understand the concern parents have. I'm a parent. I understand that a lot of people are worried about, this is going to bring in crime, this is going to do all kinds of stuff. Honestly speaking, even one of my neighbors in the units was kind of concerned about that at my public hearing, and they brought it up, and they were concerned about safety and security. It's been 8 months that I've been here, and number one, I don't have any customers because I'm only a grower. So no one's allowed to come into my shop. So it's slowly gonna take its time to make people understand that the stigma, it will slowly fade away. And if we understand the industry, we understand the purpose, we understand what growers, producers, retailers, lounges, what their jobs are and what it entails, I think we'll be able to not overcome it, so to speak, versus understand it better. Cannabis is not for everyone. That's understood. Cannabis is not for everyone, but for those that do need it, I am very happy that it is available. And when I say in terms of needing it, I mean in terms of medicinal value.
Right on. There you go. Sounds like he was trying to really explain away that stigma, Tomas, but it is what it is. People get high because it's medical. They get high just to get high. It's absolutely okay because it's legal.
Yeah, and so that was Victor Cabrera, owner of T. Marianas. And then also we sit down with Alexis Hofschneider from Tinian, who is the general manager of Commonwealth Cannabis. And Chris, I love one of the things she said before we ended the interview. When you walk in, we're not going to judge you. We're just going to sell you cannabis. And I thought that was one of the best sales pitches that I heard. So just to address that stigma as well. And they also talk about some of the things they see that need to be improved with the industry here as well. And so obviously in this pandemic, our economies are being choked. And lots of different industries, always a conversation about diversifying. What does that actually look like? Well, this is it, right? And so they throw in their 2 cents. They talk about the tax on it. They talk about the zoning on it. And so it's just a great conversation. You can tune in tonight after prime time.
And it's
Thank you.
Really interesting We
Yes,
have,
Jay.
like on 2 successive business days, Chris covers, like the Guam angle about cannabis and, for health purposes, for the economy, and then Tomas covers it from the regional perspective. I mean, I don't need Cheech and Chong. I've got Chris and Tomas.
Well, yeah, that's all you need, I guess.
I'm going to email Sabrina.
Hey, go
Tomas-
watch Up and Smoke, man. It's on Netflix. It's a great movie.
Tomas, I know you got a hard out at 9, so we'll let you hit the road.
All right. Thank you, guys. Have a good day.
There you go. Tomas
That's
Manglona,
it.
our regional correspondent, covering all things NMI this morning. We'll go ahead and do our Chamorro News update, which is brought to you by our friends at First Hawaiian Bank. And here with your Chamorro News, Uncle Ken Concepcion.